Hello, and welcome to the Medical College of Wisconsin's Coffee Conversations with Scientists. I'm your host, Raina Andrews, and for those tuning in for the first time, let me introduce myself. I'm a mother, a children's book author, a public health advocate, a TEDx speaker, and an engaged community member. Since 2021, we have been sharing the science behind today's most important health topics. Coffee Conversations is brought to you by the Advancing a Healthier Wisconsin Endowment, which is a statewide nonprofit working to improve health and advance health equity in Wisconsin. Today, we have a very special show. We want to welcome you back for our virtual coffee break. If this is your first time, welcome. Today, we're diving into sickle cell disease, which is a devastating condition that affects over 100,000 people across the United States. We'll discuss the impact of this disease on patients, particularly the severe pain that comes with it and the challenges in finding effective pain management solutions. Today, we're honored to be joined by Dr. Cheryl Stucky, who is the Marvin Wagner Endowed Professor at the Medical College of Wisconsin. Dr. Stucky is leading groundbreaking research and will be exploring the latest advancement in pain management strategies. So we want to welcome Dr. Stucky.
Thank you, Raina. It's a pleasure to be here with you all.
Yes, thank you. So for those of you out there in the interwebs, we will be covering a great list of questions regarding sickle cell disease. We'll have a lot to cover in a short coffee break. However, be sure to note your questions in our chat. We'll try to get to as many of them by the end of our show. So let's get into it. Dr. Stucky, what I like to do at the beginning of every show is to not assume that our audience knows everything there is to know about sickle cell disease, and some people only know it by name. So I love for us to just level the playing field, if we may, and have you explain what sickle cell disease is and how it affects our body.
Great. Thanks, Raina. I'll show a slide here to help illustrate. So sickle cell disease is a group of inherited blood disorders that affect hemoglobin. Now, hemoglobin is the major protein that carries oxygen in your blood cells to your tissues. So normally in your blood cells are donut shaped and they're very flexible, like little inner tubes that move throughout the capillaries and blood system. However, in sickle cell disease, the red blood cells become sickle shaped and sort of like a canoe and crescent shaped. And this is because of a single gene mutation in the hemoglobin molecule. And so what happens then is these sickle red cells get stuck in the capillaries, block the capillaries, and lead to something called vaso-occlusion, where blood cannot get to the tissues. Also, these sickle red cells are very, very fragile, so they fall apart. And when they fall apart, they dump their contents into the bloodstream. And so because the blood goes everywhere in the body, that means that many different organs like the lungs, the kidneys, the heart can all be affected by sickle cell disease.
You know, that's one of the best explanations I've heard, Dr. Stucky, and this visual is so key to show the difference that the shape makes. I think what's important for people to know is that my understanding of sickle cell is that sickle cell disease has been described as the most common inherited blood disorder in the United States. Can you share some statistics on its prevalence and impact? Because I only thought it predominantly affected African Americans, but can you share some other statistics?
Absolutely. Yeah, so there we are. Yeah, absolutely. So there we go. So it's amazing that about 500,000 babies are born every single year in the world that have sickle cell disease. And over 75% of these kids and these individuals live in regions, countries within sub-Saharan Africa. Also, it's not just sub-Saharan Africa, but regions of India and the Caribbean also have a high prevalence. And this high prevalence is correlated wherever malaria was endemic, because malaria, having sickle cell disease trait is actually protective against having malaria or getting malaria. So on the whole, over 8 million people in the world have sickle cell disease, and they're living with sickle cell disease. And in fact, sickle cell disease is one of the top 20 reasons that cause death of children that are 5 years and younger. Usually this is because of the infections like pneumonia that are associated with sickle cell disease, particularly in the young individuals. And in Wisconsin, there are about 100,000 people that are living with sickle cell disease, or sorry, in the US, there are about 100,000 people that are living with sickle cell disease. And in Wisconsin specifically, there are about 1,300 people. And about 25 babies are born in Wisconsin every year with sickle cell disease. And most of the individuals in Wisconsin, 80% of those live in the Milwaukee region.
Oh, wow. So do both parents have to have the sickle cell trait?
That's right. Both parents would have sickle cell trait, have to have sickle cell trait, and then about 25% of their children would have the probability of having sickle cell disease itself. And about half of their children would also have trait.
Oh, wow.
Yes.
I have a couple of friends, two that come to mind, who are in their late 30s, early 40s, who have sickle cell disease, and they complain of being in a lot of pain. I'm just wondering what causes the pain during this vaso-occlusive episode, and how does it differ from other types of pain?
Yeah, that's a great question, Rena. And that's a question that my lab and my group is still working to understand. So the pain in sickle cell disease is in fact unique from other types of pain. So we know that the sickled red cells get stuck in capillaries and they block the flow of blood and oxygen to distal tissues, causing ischemia or lack of oxygen. And this does cause severe onset of pain. And these, just so you know, these events have in the past been called crises or acute pain events. But we also know that other things contribute to the pain. For example, the sickled red cells, they're sort of this crescent shape. They have sharp edges, and those sharp edges damage the lining of the capillaries and blood vessels, causing a micro vaso inflammation in the blood vessel itself. And then also those red cells, sickled red cells, are very fragile. And so they fall apart 10 times as easily as a normal red cell. And when a cell falls apart, it dumps its contents into the blood. And so all those contents like free heme are flowing throughout the body and again can affect the organs and tissues anywhere across the body. So because sickle cell pain it's inflammatory, it's ischemic, and it's also nerve injury or neuropathic, it is more complex than other types of pain.
Mhm. So my two friends, they're females who have sickle cell, are African American. And I've always thought of this as an African American disease, but are other ethnic groups impacted by this?
Yeah, absolutely. That's a great question. There are individuals who are from India, in the Caribbean, in Jamaica, for example. Jamaica actually has the highest population other than individuals from sub-Saharan Africa. Jamaica has the highest population of individuals with sickle cell disease. Also, certain Hispanic groups have a higher prevalence as well.
Mhm. That's really interesting to know because I had no idea that folks outside of African Americans were subject to sickle cell disease. Now, I'm curious with your research, how does your research at the Medical College of Wisconsin truly aim to understand the neural basis of sickle cell disease pain, and what are some of the promising findings so far?
Yeah, absolutely. So several years ago, my lab discovered that there's a specific protein in pain receptor neurons called TRPV1. But anyway, this is interesting because it is the very protein that is activated by capsaicin. Capsaicin is the hot ingredient in hot chili peppers, right? So it's this capsaicin receptor. And we discovered that this capsaicin receptor is responsible for driving a lot of the pain that occurs in sickle cell disease, both the acute pain and the chronic pain. And so individuals or physicians have done clinical trials on this using blockers against this capsaicin receptor. And while it does block the pain, it causes problems because then the patients are not able to protect themselves from like a hot stove or a hot iron. And so what we're now looking at is, are there things upstream to this capsaicin receptor that we can block and inhibit. And one of those things is called tumor necrosis factor. It's one of these inflammatory cytokine molecules that is elevated in sickle cell disease patients in their blood. And fortunately, there are FDA-approved drugs that block this TNF from binding to its receptor, and those treatments are already in use for rheumatoid arthritis. And so we're hoping that perhaps we can repurpose these inhibitors for patients with sickle cell disease to alleviate their pain.
You know, you mentioned that they cannot protect themselves from hot stoves or iron. Say more about that.
Right. And
Because
yeah, so that's when that's in the clinical trials where these patients that had pain were treated with the inhibitors against this capsaicin receptor. And because the capsaicin receptor, this TRPV1, it's important for how you sense basic pain stimuli. And so when you put your hand on a hot stove and it burns your hand, when you first feel that heat, it's because the heat has actually activated this TRPV1 receptor. And so if you block that receptor, then you dampen your sense of pain.
Mhm. Um, so with this pain, and I'm just going to use my friends as an example because that's really my reference for how I understand sickle
Mhm,
cell disease.
mhm,
There are times where they're experiencing episode and they're rushed to the emergency room because
mhm,
like they just can't bear it. They said it's almost like their skin is on fire. Like they just really want it to go away. And
mhm,
there's been some profiling in the emergency room where they've been told, or there's been this stigma that they're just there for opioids. And I'm really curious with your research, um, despite its prevalence, you said 100,000 across the United States, there still seems to be a limited number of effective non-opioid treatments for sickle cell
mhm.
disease related pain. What are the major challenges in really treating this kind of pain?
Yeah, that's such a good question. The major problems for these treatments is they're not that effective against the acute pain, and these treatments, these non-opioid treatments, also have a high side effect profile, so they cause other problems in the body, even though they can somewhat dampen the pain. And unfortunately, the opioid medications like morphine and oxycodone are still the most effective thing that blocks the pain, the acute pain when these patients are coming into the emergency room. But as you said, in the emergency room, it's very hard for individuals to get opioids, and particularly if they're coming from a certain demographic, they they may be already assumed to be, seeking medication, seeking opioids when it's actually not true. They're really there for the relief of this acute pain, which is horrible.
Hmm. So, I mean, when you talk about morphine and oxycodone, well, those are highly addictive
Mm.
narcotics. And I'm just wondering what recent advancements have been made in the field of pain management for sickle cell disease, and how might they offer new hope to patients?
Right. Okay. So that's a great question. So while there are therapies that we're working on that are pharmacological therapies, there are also therapies that have advanced treatment in the gene therapy and also blood transfusions. And so gene therapy is effective in reversing the hemoglobin deficit. And so the patients do not then experience the vaso-occlusive events and the acute pain. However, there are questions in terms of whether the overall chronic pain that patients have once they have chronic pain, whether that will be alleviated by gene therapy. And then there are also issues with gene therapy in that only a certain profile of patient can get the therapy. They're usually in their 20s, very healthy, other than having sickle cell disease. Um, they're, it's very expensive, so it's not widely possible to get this gene therapy, and there are side effects of the gene therapy.
So, sickle cell disease is an inherited blood disorder. I want to turn this over to the audience because I see quite a bit of activity here in the chat. The first question, Dr. Stucky, is with all newborn screening programs now testing for sickle cell disease, at what other points is laboratory testing performed for diagnoses?
Right. I think well, as soon as a physician knows that this patient, this baby has sickle cell disease, then they are immediately put on as soon as possible. They're put on um, uh, um, antibiotics to prevent pneumonia. And then they're continued to be followed throughout their lifespan. And we have a fantastic sickle cell clinic right here in Milwaukee that for children is headed up by Amanda Brando. And then for adults is headed up by Josh Field. And they are followed throughout their lifespan.
Mm-hmm. And so earlier on, you mentioned that it's um, two parents have sickle cell and the child is likely to be born with sickle cell disease. Is that correct? Did I understand you correctly?
Yeah, so if two parents have what it is, it's called trait.
Mm-hmm.
What trait means is that the parents each have one copy of the mutation, and the other copy is normal. So basically, they have their so they have one copy that has the mutation, and if they then marry and have children, then they have a chance of having about a 25% chance of having a child with sickle cell disease
Okay, so if
because
one
the child with sickle cell disease needs to inherit the two copies of the mutated gene.
got it. And
Yeah.
so if one person has the trait, does that likelihood significantly decrease?
Yes, that's exactly right. So then offspring would have a somewhat of a small chance of having trait, but not like they won't have sickle cell disease itself because they don't have the two copies of the mutated gene. Right.
If you have
Correct.
if you have the trait, is that commonly known, or would you have to have specific blood work done for that?
You would have blood work to determine that. You'd have genetic blood work done, and then you would know that you trait, and you would probably have a idea of whether you might or might not have it based on your parents' history, and then you would. The other thing is with trait, individuals generally are healthy, but they also can suffer from pain and exercise induced issues at times because they have traits. So they're not they what I'm trying to say is sometimes they do have issues, but in general they're healthy.
Mhm. Another audience member, thank you for that. Another audience member is asking, what type of support does the Medical College of Wisconsin provide for their patients with sickle cell disease? Support groups, holistic options?
Right, that's a great question. So I believe they do provide support groups and also holistic options like dietary help. For example, patients with sickle cell disease need to stay hydrated. They have to have a balanced, healthy diet. Often they need to have vitamin D supplements and other types of supplements. So there are quality of life support groups also for patients with sickle cell disease here at MCW. And the wonderful thing is that MCW and Freighter, we know that these physicians, Dr. Brando and Field, who treat these patients, they know who the patients are in Milwaukee. And so they've followed them since they were little on. So that's great. They have a great relationship with their parent or with their patients.
Another question is that sugar is cancer to many parts of our body. How does sugar affect people with sickle cell disease?
Right. So I don't know the exact answer to that question, but I do know that having a low sugar, healthy, balanced diet is absolutely going to help the patient be healthier.
Mhm. And we're not registered dietitian nutritionists. We haven't done deep studies, so I think that was the perfect answer. Do people with sickle cell disease typically know they have it? Are there issues with misdiagnosis or undertreatment for this disease?
Yes. So patients with sickle cell disease usually know that they have it. There are easy blood tests to determine if you have it. I would say the region or the area that is undertreated for sickle cell disease is the pain. is especially not only the acute pain, but the chronic pain. So what I didn't mention is that when patients have a vaso-occlusive event, they often have multiple vaso-occlusive events over, let's say, a year, and that seems to prime somehow the nervous system and the body to then develop chronic pain. And so about half of the patients will, by the time they're adolescents and adults, also experience chronic pain. And many of these patients are dealing with that chronic pain on a daily basis, and they often deal with it at home. They're not coming into the hospital or the ER. They try to find ways to deal with that at home. But I would say that's an area where they're undertreated and underserved.
Mhm. So if a pregnant woman who has the trait has
Mhm.
been diagnosed with sickle cell disease, is there any sort of special maternal care she needs to optimize her health during her pregnancy and or the baby's long-term health outcomes?
Right. So she should know. She should let her physicians know. They will put her on a regime to take very good care of her. Um, Women that have sickle cell disease, in particular, they have a much harder time during menses and during pregnancy, before pregnancy, during pregnancy, after pregnancy, and they have more pain than a woman that does not have sickle cell disease. So there's a lot of care that goes around a pregnant woman and after birth, and for the baby, of course, as well.
Mhm. And so as a follow-up to that, is if a woman has the trait and she doesn't have sickle cell disease, could they identify in utero that the child has sickle cell disease?
Uh, I, I I believe that they could with genetic testing, yes. And usually, again, the newborn screening is done after birth, but I believe, yes, they can determine that, yes. And again, the child will only have sickle cell disease itself if she had trait and she married someone with trait, or she were partnered with someone who had trait.
Wow. So I'm going to go off course here just for a second. So earlier this season, you were just in Jamaica studying
Mm-hmm.
medicine with the prevalence of sickle cell disease in the Caribbean. I'm curious about the difference in care that we have versus folks in the Caribbean, let's say in places like Jamaica.
Right. So that was an eye opener for me. First of all, I did not realize that Jamaica is just made up of a tremendous number of small islands and small communities. And so it's very hard for an individual that lives on a small island to get care. They often have to be taken by boat or flown over to another place where there is a hospital to care for them. The second thing is in Jamaica, which has the second highest population of patients with sickle cell disease, they're only approved for a drug called hydroxyurea, which is a standard of care for sickle cell disease, but they are not approved to do gene therapy. They're not approved to do bone marrow transplants. It's illegal to do those things. So their standard of care is much different than in the United States, where it's generally quite easy to access healthcare in the United States in terms of a logistical standpoint.
Mhm. And so if they're able to come to the United States, do you know if they come here or they just have to settle for what's available there?
I think if they have the funds and the money and the healthcare will support them to come here, they can. But I think in general they don't. I think in general their care is managed in Jamaica and they're often put on hydroxyurea, which it's a drug that does it reduces the frequency of having these vaso-occlusive events, but it also has side effects. And also, that drug has to be monitored closely. So there are some compliance challenges. Yeah,
Well, thank you for answering that. I know we went a bit off script here, but I was very curious about that. And when you went over the prevalence across the globe and you highlighted
Mhm.
Jamaica, I thought it'd be helpful for our audience to understand your body of work there and the most recent intersections. And so
Absolutely.
Yes, we have just a few more minutes now, and so we have just a bit of time for a rapid round. So, can you please share the top three things people need to know about sickle cell disease? We could talk about genetics, how people can help manage the sickle cell disease, and how people can take action, maybe.
Right. So one thing I think individual or people need to know is that even though we have gene therapy for sickle cell disease, um, it's not widely available. It's expensive. It's can only or is only done in very healthy patients at this point. It does have some side effects. So it may become standard of care in 25 years from now. I hope that it will. But right now, it's not widely available. Bone marrow transplants also can completely reverse the disorder by basically treating the stem cells of the patient and putting those stem cell or putting those cells back in. However, again, bone marrow transplants also have complications. So research needs to continue to happen on understanding how we alleviate the pain because it's not clear that um, either gene therapy or bone marrow transplants will alleviate the chronic pain that patients have once it's established. And then diet. I think diet, exercise, healthcare, that's incredibly important for patients to eat a balanced diet, to make sure their nutrients are taken care of, to stay hydrated, to reduce their stress, to reduce their exposure to cold, because one of the precipitating factors for a vaso-occlusive event is exposure to cold. And if you live in Wisconsin, you're often exposed to cold. And so moms have to protect their kids from standing out at a bus stop in the cold weather or jumping into a cold swimming pool. And then finally, I'd say it's really important for people to understand what sickle cell disease is, to spread the word to the community, and to help. You definitely can get involved in helping. For example, you can donate blood, especially if you're Black American. You can definitely donate blood, and this because they're normal, healthy controls are the best match for individuals with sickle cell disease. And then you can serve as a healthy control for any kind of sickle cell disease, any kind of research on sickle cell disease. And of course, you can donate, for example, a small donation to to our lab and the clinicians we work with could help fund a student to go to a sickle cell disease conference and present their research and learn from others doing research on sickle cell disease.
Mhm. And so, Dr. Stucky, if any of our audience members wants to follow up on anything that you've shared or get involved or volunteer or make a contribution, where
Mhm.
should they go?
Well, they can come to me directly, and or the Medical College of Wisconsin. I have an email, cstucky@mcw.edu. I'm very easy to find on the internet, Cheryl Stucky. And again, anyone that would like to help with our sickle cell disease research can let me know or let the Medical College know. And you know, even $25 will go a long way to helping our students and trainees do research.
That's wonderful. And that's CSTUCKY@mcw.edu.
That's
Correct?
correct.
Awesome.
You said it exactly right. Yes.
And so, with that, I want to thank you, Dr. Stucky, for joining us today. We appreciate you taking the time to talk with us about this very important topic. It means a lot. Thank you.
Thank you so much. It means so much to me that you have asked me to come here and to talk about our research. And it means so much for our community and for our patients in our community with sickle cell disease. I just thank you so much.
Absolutely. And if for those of you out in the interwebs who have been tuning in and we didn't get to your question, please, or if there's an afterthought, please email us at conversations@mcw.edu. Also, as we're aligning our 2025 calendar and there's a topic that you're like, oh, I really want us to talk about this, please send me a note at conversations@mcw.edu. And so I hope you all join us next month for a virtual coffee break and a conversation with the scientists. Take care.
Thank you so much.
Thank you.